The 89th legislative session is in full swing. Thousands of bills have already been filed by legislators. Accordingly, some details on bills can be overlooked, even with critical legislation. That's why we've asked legislators to come to TPPF to discuss their bills to ensure that you are on top of the most important issues making their way through the Texas Capitol. This is The Layout. Today, we're discussing HB 2038 with Representative Tom Oliverson from House District 130. Representative Oliverson, welcome to The Layout.
Thank you, Nick. It's a pleasure to be with you again.
HB 2038 creates 3 new licensing pathways for Texas to help address its provider shortage. One for foreign licensed doctors, one for military veterans, and one for graduate physicians. Dr. Oliverson, can you tell us what sparked the need for this legislation?
So, the obvious need for this legislation, we talk every session about shortages in healthcare providers, particularly doctors in primary care. And this has been a problem. We've been doing many, many things to try to address it. But the reality is that these shortages persist. And so, it kind of came to me last session. I started working on this with one piece of the 3 here. And that is that, essentially there are people out there who are willing to come practice medicine in our state, who are capable of practicing medicine, who have received the training, and current state law prohibits them from actually being here at all. And so the idea was to bring them to our state by creating an environment where we could put them to work in medically underserved areas and rural communities.
I know that's a very important thing, is empowering the people who want to come here, but due to excessive licensing or other barriers, reducing those so we can have those. So walk us through the bill about how that removes some of the regulations or empowers these medical professionals to come to Texas and practice.
Yeah, so there's really 3 buckets of folks. And to be clear, we're talking about people who are doctors that have a physician degree, an advanced degree in medicine. This isn't the kind of bill where we're basically promoting somebody to a higher level of being able to provide care from some other type of training pathway. These folks are all physicians, but they're not able to practice here, or the pathway whereby they could practice here is so difficult and convoluted that they choose not to practice here. So a good example of that is one piece of the bill deals with expediting medical licenses for veterans who are honorably discharged who practice medicine in the military, as long as they have had an active medical license in another state, that they should get to the front of the line. We should get them their licenses as quickly as possible because they've demonstrated and have been practicing medicine in the military for years.
No, certainly that sounds like a great idea. And so the third section of the bill touches on some of the medical graduates.
Right.
How would this bill help the graduates who maybe don't match with their residency program? What does your bill do to help?
Yeah, so this is the really interesting piece of this bill in terms of the story. I think conceptually people can understand, oh yeah, military doctor, get them here quickly, that makes sense. Okay, there's a doctor and they trained in another country, but they can pass all the same board exams and they have the same medical knowledge as our people, and they've been practicing elsewhere, so why not? Why not bring them here and let them practice? But most people don't realize that not every medical student that graduates from medical school gets accepted into a residency program when they start. And it's really not what you think. It's not people who are sort of at the bottom of their class that, nobody wants them. It's typically young people who are in the bottom of the top quarter of their class who aimed really high for a highly competitive residency, and they just didn't make the cut. And folks don't know that the match for residency for postgraduate medical training is all or nothing. You either get what you asked for or you get nothing. And so these folks are really left with no options. Some of them graduate from medical school and end up working in Starbucks, even though they have a medical degree, because they can't do anything else. So what we want to do is give them a pathway to be able to work as a resident physician would, as their classmates are, but work under the supervision of another licensed doctor in a rural community where they can actually expand the reach of that doctor's practice and provide care in the areas where we need care. These are folks that have had well over 10,000 hours of training in their 4 years of medical school and have a doctorate in medicine, and they're having to work a dead-end job because current statute doesn't allow them to use their skills.
So one question that the legislature is tasked with, or hears a lot from their communities, is healthcare access, particularly for rural communities. How would your bill help rural communities in Texas?
So in all three phases of our bill, what we're doing is providing more trained doctors to work in rural communities and medically underserved areas. Obviously, I think the veteran piece is somewhat self-explanatory. The foreign trained doctor piece actually is fairly unique in that it provides a pathway that requires them to practice in a rural and medically underserved area as a pathway to getting not only licensure in our country, but also being eligible to pass their boards. And that's something that no state until now has actually looked at. And it's one of the things that makes the Doctor Act very unique is, so right now in Texas, a foreign trained doctor can come to America, get a visa or a green card, whatever. But all they will be able to do is work as a technician. They'll never be able to practice medicine, certainly not in their specialty. A lot of them are OB-GYNs, which we desperately need in our rural areas. And so sort of the conventional wisdom was, well, create a pathway for them to get some type of licensure so that they can fill a need, but they're basically doing primary care. And so what we said, which is slightly different, is no, we want them practicing first in an ACGME accredited facility, which is many hospitals across our state, for 2 years. Then we want them in a rural community for 2 years. And the whole time this is going on, the medical board is building a case file on them that it can then turn over to the ACGME, which decides whether you get your boards or not. And they become board eligible. So it's a pathway to full licensure over time, but you have to put the sweat equity in our rural communities. And the hope is that in that process, folks will put down roots and they will choose to stay. With the physician graduates, we're going to specifically bracket that bill on the House floor today so that the physician graduates will be practicing in communities and in counties of 100,000 people or less. So that really has a strong rural healthcare focus to it by the time it leaves the House today.
Yeah, it sounds like this bill really is geared towards trying to bring those doctors or those medical professionals into those rural areas. So after filing HB 2038 or the Doctor Act, have you received any pushback from the bill, or tell us some of the things that you've been hearing since filing this legislation?
So, I mean, I think, yes, there is a little bit of apprehension. Obviously, I don't think anyone has complained about the veteran piece. I think that's pretty easy. Everybody understands that. The foreign doctor piece, folks are wondering, well, how do we know that they've been properly trained? How do we know that they know what they're doing? And to that, I reply that, again, the medical board will require them to take all 3 steps of the medical licensing exam and pass those in order to complete this pathway. And they will be put on a 4-year supervised track where we're keeping a close eye. They're actually at a training facility for a couple of years, not in the training program, but working in the same facility where there are doctors who are used to training doctors who can observe and make sure that they're doing the same kind of quality work. The physician graduate piece, I haven't really gotten a whole lot of resistance on that. I think most folks, as I said, don't really know that there is an alarming number of folks that we put through medical school for 4 years, and part of that is state funded, and then they don't get into the residency of their choice because dermatology and neurosurgery are pretty competitive, and they get nothing. And so it's literally like 4 years wasted. And so we want those folks to be in the medical workforce. We want them using their skills. And so I think that, the resistance to that has been fairly limited.
Well, thank you for stopping by and to explain HB 2038 to us. Thank you, Dr. Oliverson, for joining the layout.
Thank you, Nick. Appreciate it.